Patients often do strange things to their mouths. Most are not intentional. Oral mucosa is durable, but it is fragile. We all have injured ourselves at one time or another. We'll first discuss physical injuries to teeth, gingiva, the tongue, and mucosal tissue. Attrition is the loss of tooth structure due to tooth-to-tooth contact, in this case, bruxism and clenching. Bruxism and clenching are potentially highly destructive to teeth with side effects extending to the TMJ and related head and neck musculature. Tooth damage can be mitigated by fabrication of a night guard, since most bruxing and clenching episodes happen at night. Abrasion is the loss of tooth structure due to an externally supplied force or source. The most common form of oral abrasion is abrasion from toothbrushing. Abrasion causes wear of the cervical area of the teeth affected. This in turn may cause sensitivity and aesthetic issues. Erosion is the loss of tooth structure due to chemical exposure. Erosion is a chemical process. Patients with erosion have habits that allow prolonged exposure to acidic substances. High acid foods and a high rate of consumption of those foods may accelerate the erosive process. Since there is a loss of enamel, many patients experience sensitivity. Loss of tooth structure from flexural forces is called abfraction. When teeth are in function, they are subject to many forces. One of these is flexure. They will either flex buccal, facial, to lingual. It is theorized that as teeth flex, the cervical area is the weakest part of the tooth and a fracture occurs. Abfractions are then a result from flexure. Anecdotally, patients with abfractions report almost no sensitivity, but their chief complaint is food impaction. Fracture is any break in tooth structure not from a carious lesion. It can be caused by trauma or excessive occlusal pressure like bruxism and clenching. A September 11, 2020 New York Times article noted that dentists have seen a marked increase in fractured teeth during the pandemic. That should not be surprising given the amount of stress brought on by the pandemic. There are different types of fracture. There are cusp fractures, crown fractures, crown and root fractures, a split tooth, and vertical and horizontal fractures. The extent of the fracture determines treatment. And to the right there, you can see the different types of fractures that occur in teeth. Avulsion is the forcible displacement of a tooth. It's usually caused by trauma, like accidents, sports injuries, falls. Optimally, the tooth needs to be replanted within 5 minutes, or 20 to 30 minutes or longer if the tooth is stored correctly. The protocol for preserving an avulsed tooth is for reimplantation, unless it is done immediately, is to 1. Either submerge the tooth in a carton of milk, or 2. Place the tooth in the vestibule of the patient's mouth. The tooth should never be brushed or cleaned to preserve the periodontal ligament. External resorption is resorption initiated by the periodontium. And internal resorption is resorption that originates in the root canal. It is impossible to determine most times from radiographs whether the resorption is external or internal. The radiograph on the left is pretty clear that the resorption is external. Although the literature recommends root canal therapy, many endodontists are leery of treating resorbed teeth, since there is no way to know the extent of the resorption. The etiology is speculative. Trauma is the most widely accepted cause. Ankylosis is the pathologic fusion of bone to cementum. Generally, the cause is thought to be excessive pressure or long-term excessive pressure and trauma. It is most common in deciduous teeth. Ankylosis makes extraction extremely difficult. The use of toothpicks have gained in popular use as an oral hygiene aid. When used properly, they can be helpful, but when used improperly or too aggressively, there can be tissue damage. We are all aware of toothbrush trauma, too vigorous brushing, incorrect method of brushing, using too hard a toothbrush, which all contribute to trauma. Hairy and fissure tongue are not strictly caused by physical injuries. Fissure tongue is found in about 5% of the population. If the fissures are deep and are not properly cleaned, they can become inflamed and irritated. Hairy tongue is caused by elongated papillae. Again, fungus, bacteria, and debris can collect and cause irritation. The color is determined by the patient's diet and the presence of a smoking habit. Generally asymptomatic, benign migratory glossitis gets its name from the fact that patchy areas appear to migrate. It also has a map-like appearance, hence geographic tongue. The patches are areas of loss of filiform papillae. Stomatitis areata migrans is the technical name for benign migratory glossitis on the ventral surface of the tongue. Here are 3 examples of factitious injuries. Factitious injuries are injuries that are self-induced either intentionally or unintentionally. So on the far left we say lip bite, which is common in post-anesthesia. Patients, especially when you do a mandibular block, may bite their lip while anesthesia is still active. Some people lip bite from habit, and sometimes it's trauma. It's not intentional. Tongue bite is usually from trauma, can be caused by malocclusion, and post-anesthesia can also be the cause of tongue bite. Cheek bite can be traumatic or accidental. It's also a habit. There are a lot of patients who do cheek bite as a nervous habit and can be part of the post-anesthesia problem before the anesthesia wears off. Sadly, electrical burns occur in very young children. As they begin to explore their world, the impulse to taste and bite often collides with a plugged electrical cord lying on the floor. Facial damage can be severe. It is painful and sometimes required reconstructive or plastic surgery to correct the defect. Systemic as well as topical chemicals can cause severe injuries or damage to the oral cavity. And we will talk about radiation injuries, chemical injuries to the teeth and mucosal tissue. Radiation therapy is used to treat some forms of head and neck cancers. While radiation techniques have been refined, depending on the site of the cancer, other structures may be in the path of treatment. Radiation mucositis is a very severe form of radiation injury. Note the bright fire engine red tissue in the illustration on the far left. Radiation caries are a side effect of xerostomia that is usually caused by the radiation therapy. Notice the location of these caries. They're not in the usual types of areas where patients get caries. And osteoradionecrosis is the result of infection and radiation therapy. That's why patients need to be, checked out completely, have a complete dental examination before they begin the process of treatment. All these are side effects of treatment. Pre-treatment dental exam and treatment of all dental disease needs to be done to ensure minimal dental problems during radiation therapy. During treatment, the patient needs to maintain optimal oral hygiene practices to prevent radiation caries. Ingestion of certain substances may have good and bad effects on teeth. Tetracycline, an antibiotic, is no longer given to expectant mothers and young children because of its uptake into developing enamel and subsequent discoloration. Fluorosis only occurs when a patient has resided in an area where naturally occurring fluoride are above optimal levels. Many times in the clinic, students will note some kind of hyper or hypocalcification by saying the patient has fluorosis. If we question the patient further, we find out that the patient was born and raised in Hawaii. And since Hawaii has no naturally occurring fluoride nor fluoride added to the water, what you're looking at is not fluorosis. It's some kind of hypo or hypercalcification. I have added aging because teeth become darker naturally with age, but it can be exacerbated by habits such as smoking, high intake of coffee or tea, and highly colored foods. Dilantin is the drug of choice for the treatment of epilepsy. The gingival tissues can become hyperplastic to the extreme that surgery is required. Good oral hygiene keeps the tissues from becoming hyperplastic. When a caustic substance comes in contact with oral tissue, the result is a burn. Most patients would not knowingly ingest such substances, such as lye. However, they would place an aspirin tablet adjacent to a sore tooth in hopes of alleviating the pain. The result is a tissue burn. Other substances patients like to use is hydrogen peroxide. Usually they will dilute it, but, quote, if a little is good, a lot is better, end quote. There are over-the-counter mouth rinses with hydrogen peroxide, which would be safer to use. Amalgam tattoo is an iatrogenic lesion. It amounts to literally tattooing amalgam fragments into tissue, usually the result of the removal of amalgam or in the process of preparing a tooth with an amalgam restoration for a crown or a replacement restoration. Graphite tattoo is most commonly found in the palate. The story is that young children would run around with a stick pencil in their mouth, then get the graphite tip accidentally punctured into tissue. And I don't know if children still use those kinds of pencils anymore. They may be using something else. But you do see in some older adults the remnants of a graphite tattoo. This concludes the lecture on physical and chemical injuries. Again, if you have any questions, please do not hesitate to let me know.